rural community engagement here at Interact for Health. I'm really excited to have you all here with us this afternoon. Let's go to the next slide. So this is our agenda for today. We're going to start out with a quick welcome. We're going to learn a little bit about Interact for Health. Then we're going to jump into more information about the Rural Changemaker. Then we're going to talk about the application process. And then at the end, we're going to have time for questions. For those folks who would like to come off mute, you can ask your questions and you can also put them in the chat if you'd like. So let's go to the next slide. So again, welcome everyone. I've introduced myself, but I'd like to take a minute to invite my Interact for Health colleagues to introduce themselves as well.
Good afternoon, everyone. So good to have you all join us, see some familiar faces and some new faces. My name's Megan Folkerth, and I am just here to support Caitlin and the great work she's doing in the rural communities. Grace?
Hi everyone, my name is Grace Shields and I'm with Interact for Health on the communications team. Um, I'm very excited about this grant. I love our rural work. So I'm very excited to hear what Caitlin has to say.
Thank you all so much. So let's go ahead and learn a little bit more about who we are at Interact for Health as an organization. So our vision here at Interact is to create a world where we all can live long, healthy lives. So we know there are very real factors, though, that can contribute to people in our communities not being able to do that equally. That is why we work to advance health justice for everyone. Let's move on to the next slide. So there are values that help shape our path, and we're a key part in developing how we approach our rural work. So you can take a minute and just kind of read through our values here. Let's move on to the next slide. So this funding opportunity is specifically designed to serve our rural communities. So for our purposes, we define rural communities based on population density and available resources. So that's areas with lower population density that have been historically under-resourced with lower federal and state funding. So that means reduced local investment, fewer resources compared to urban and suburban counterparts. So this funding opportunity identifies these specific counties within each region and highlights the importance of tailoring efforts to their unique needs. So in Indiana, this is for Dearborn County, Franklin County, Ripley County, and Ohio County. Oh, and Switzerland County, excuse me. In Kentucky, this is for Bracken County, Gallatin County, Grant County, and Pendleton County. In Ohio, this is for Adams County, Brown County, Claremont County, Clinton County, and Highland County. So a lot of people think that you can only serve one of these groups or prioritize one community in your program when it comes to writing for Rural Changemaker and our priority populations. In fact, you can serve many of our priority populations when it comes to Rural Changemaker or any of our funding opportunities. We know that our communities are not a monolith in rural areas. For example, there are children and families with low income in rural areas, Black and Brown communities, and LGBTQ plus folks as well. The Rural Changemaker Grant by design is meant to dig deep into all of our populations in rural communities and challenge our partners to go beyond statistics and demographics. Many times organizations or programs might account for low numbers of engagement with our communities represented by our priority populations due to lower population overall in rural areas, but that does not mean that you can't create safe and welcoming environments that meet the needs of these communities. Let's move on. So there's 20 counties around Cincinnati, Ohio, Kentucky, and Indiana. And we improve health through flexible catalytic funding, by being a trusted, nonpartisan voice for change, by being an independent regional convener, amplifying community voice, and by being a go-to resource for data on health and health justice. Let's move on. So now we're going to get into a little more information about Rural Changemaker 2026. That's the grant itself. So we know that social, economic, and environmental factors drive health outcomes. So inequities such as economic injustice, systemic racism, and other forms of marginalization shape the experience of some groups, leading to wide disparities between different places and health of people who live in them. To address these inequalities, we must focus on changing the environments where people live by addressing root causes of issues through policy and systems change efforts. So we strive to center people affected by these policies to ensure that communities can build their own power through advocacy work, that efforts can be sustained so that communities can experience long-lasting change. The Vital Conditions Framework, which you can see here, enables several important shifts in the way that people think about health and well-being. One of the most important is recognizing that simply accessing urgent services is not necessarily enough to thrive. We use the Vital Conditions Framework because it aligns with our mission to seek health justice in the community. So, vital conditions for health and well-being are the conditions in which people are born, grow, work, live, and age, and the wider set of forces that shape our daily lives. These 7 vital conditions are needed for people and communities to reach their full potential and create an equitable, thriving future for ourselves and generations to come. These conditions are required for people and communities to reach their full potential and create an equitable, thriving future now and for generations on. So these vital conditions are a key component of this RFP. So understanding them and how they influence community well-being and health is essential. So here you can learn more about the RFP goal. So we strive for a system in which a person's health is no longer determined simply by where they live. The first step to getting there is convening our council, which is comprised of 15 individuals who live and work in our rural counties, and they help to review and score our Changemaker grant, which is only a part of this goal. So this isn't necessarily focused on a specific issue or challenge. Our communities actually identify that. So those who apply use their own judgment for their proposed project or for operations activities. What we are asking is that each applicant identify one of the 7 vital conditions that their program or project addresses in their community and how they do so. We are also asking applicants about the role of community members in how they shape and impact the program, and ultimately how the program will impact the community. The goal is to support community voice and efforts where they lead in identifying specific issue and challenge that they want to address and how it impacts health, a proposed solution, or an approach. The funding is focused on the approach and strategies that's going to be used based on the vital conditions. So there's many folks who have applied to Rural Changemaker before. So you know that we look for our grantees to meaningfully engage with our priority populations. And again, that's Black, Hispanic, LGBTQ+, children in low-income families, and rural, which based on our data experience the greatest disparities in health outcomes in our region. So we hear often that demographics are a challenge, and we understand that, which is why there is not an expectation of metrics or a specific number of people to be served or to be hit. There is an expectation to create an effort to reach out to all communities and create a safe and welcoming space for everyone. So we're focusing efforts on funding local solutions to local problems that have a strong emphasis on community voice, being and belonging and agency, and we recognize our rural communities have skills and assets already, but may need help in moving projects and outcomes forward by way of this targeted funding. Much like our efforts in previous years, Interact for Health is specifically seeking to provide funding for projects that respond to local needs and local solutions. We're encouraging potential grantees to center rural communities for leadership and as primary recipient of benefits from a project and emphasize the participation of the community. This is why we're emphasizing grassroots efforts focused on community-driven and community-led efforts in identifying one of the vital conditions for health, at least one. This does not have to be the sole focus of your project or program, but you have to highlight at least one vital condition for health. This can be a component, an aspect, or the core feature of your project or program. We are looking for systems level projects, though, with broad community-wide impact. So I mentioned earlier about our Rural Community Council. They are a 10 to 15 member body. They live and work in our rural communities, and they act as our review and score committee. The role of the Community Council is vital in this project, in this process. We here at Interact for Health do not review and score this grant. The members of our Rural Council do, and they help to inform the final funding process. So for eligibility criteria, we ask that you be a public nonprofit or governmental organization, provide service in at least one county of our 20 county service area, but specifically one of our 14 rural counties, at least one. Organizations that are not nonprofits or governmental entities can still seek this funding through a fiscal sponsorship. A fiscal sponsorship is a relationship between a 501c3 tax exempt nonprofit and a charitable project that does not have a tax exempt status. So that's the sponsor organization and the sponsored organization. So these are the details of the funding this year. The total amount available for the entire year is 600,000. 300 is going to be released each cycle. These could be either project or general operating support. The anticipated amount that you can write for is between 10 and 70,000. It is up to you how much you need. The length of this grant is between 12 and 18 months. Again, that's up to you. This is a rolling opportunity, and applications are going to be reviewed in May and September. You can only apply once a year. So the goal is to fund at least one project per state per cycle, and that's depending on the availability of funds, however, the number of applicants, and the screening process. This number may change. We may have more than one grantee per state, and likewise, we may not have a grantee for a state in a cycle if we have no applicants or based on the determination of our council members. The grant making process is subjective, and this is a very competitive grant as well. So for our grantee requirements, this is depending on the request. Awarded grantees may be expected to participate in a grantee meeting or participate in evaluation. For some of the finer details, We are looking again for intentional engagement of our priority populations. We're looking for a description of the geographic area, at least one vital condition, and a description of your community impact. We're looking for you to describe how folks are involved in the community, what's going to change, and how local folks help create the outcome. So here's a bit about what we're looking for in projects. We're looking for you to have goals for the grant that are clear and aligned with the goal with the RFP. We're looking for you to demonstrate that you can achieve those goals and for you to focus on an issue or challenge that's identified by folks locally. You can actually look at the rubric. It's available on our open funding page along with the RFP itself. So I'd mentioned earlier that you need to serve at least one of our rural counties. Please authentically engage community members in shaping the project, and that's community voice. Meaningfully engage our priority populations and identify at least one of the vital conditions for health, at least one. So when we say meaningfully engage, I keep saying that. What do we mean? If you do notice that you have communities you would like to work with more, you do not simply have to accept this as a matter of demographics. You can dig deeper and go deeper and begin the work of outreach. For example, if you are a local community center, what would it look like to partner with your region's LGBTQ plus pride organization for events? Or if you're an after school program, do you have outreach materials available for family members and students who speak languages other than English? Get creative in your unique position and space and go where the people are. So now we're going to have Megan take it from here. So Megan.
Yeah, happy to. Thanks, Caitlin. So I'm going to walk through some details, more of like the process side of how to apply through our online grants portal. If you have questions, feel free to drop them in the chat. I'm also okay with you coming off mute and asking if you want me to pause or have a specific question about what I'm talking through. We have made some changes that I'm excited about, hopefully to make it more accessible. You will notice in the application, there is a question for feedback. And a lot of these changes are coming directly from that feedback from folks that have applied to our RFPs over the past year. So we take it very seriously. We want to make changes. There's certainly, we can't do it all. There's things that we aren't able to change that are just limits of the system, but we have made some improvements this year that we want to share with you today. So on our open funding page, which I know Caitlin mentioned, if you go to that, this is a screenshot of what you'll see. There is a link to access the grants portal, and then you'll see right here a link for the 2026 Rural Changemaker RFP. So that will give you the RFP document that has a lot of the items and more that Caitlin just shared and talked through that you can access, information on the 7 vital conditions for health and well-being, that criteria, the selection criteria, things like that will all be in that document. Other helpful documents that you'll see, there are the application questions in Word form and PDF. We recognize that folks oftentimes want to work with colleagues, coworkers, community members, and they're shaping these grant applications together and don't always want to do that in the online portal until they're ready to submit. And so you can see the questions that we're asking. The full application is there, both in Word form and PDF. As Caitlin mentioned, we are also sharing our scoring rubric. This is a new addition. We've had selection criteria that we've shared in the past, but we do use a rubric, and so we want to be very transparent of the things that the Rural Community Council will be scoring against and looking for. There's also a link to a learning and evaluation outcomes template. This is an optional tool In the application, you'll see a section that's, what does success look like to you? What are you hoping to achieve by the end of this grant? And you can provide descriptions, you can upload files if you have information you've already built out, or if you are newer in the process and haven't put, a lot of time into thinking about the outcomes, the evaluation, there is a template that can help you think through some of those things. But again, this is just an optional resource for folks. And then to go along with that, there's an evaluation and learning 101 slide deck that our learning and evaluation team has provided for folks, again, if they need support in thinking through what that would look like for your work. This just highlights the webinar that we're on here today. You can see that's where you'd register. After this, the recording will be linked here. So if there's something you want to go back, if there's someone else at your organization that you want to share, this webinar will take the place of the registration link. In addition to today, we also will have office hours that Caitlin will be leading. You can see them listed here. Ohio, Indiana, and Kentucky, one in each location. There is no need to register for these in person. This is come and go as you please. Pop in, ask questions, meet Caitlin. She's a very lovely individual and has so much knowledge to share. But this is a place, if you have questions about the RFP, your project specifically, you could pop in there. We also are doing a virtual office hour on April 3rd from 1 to 3. For this one, we do ask that you register just so that we can send you the link versus having an open online link. But again, that is also a come as you wish. There's not a formal presentation. It's just Caitlin and staff being available virtually to answer questions that folks have. So please take advantage of those if you have questions throughout the RFP process. So how to get to the grants portal, there's a couple of places. So if you go to the open funding page, which we've been talking about, the shortcut is interactforhealth.org/open funding. You will see highlighted here the access the grants portal button. Also, if you are on any page of our website, up in the top right-hand corner, there is a link to access the grants portal as well. So you should be able to get to it from any page on our website, but it is specifically linked on the open funding page as well. And then if you do have questions about your account, things like that, you can always contact our Director of Grants Management, Christine, who you see her contact information here on the right side. We have also created, thanks to Christine, an applicant tutorial that has a lot of information of walking through setting up your account in the grants portal, what that looks like. If your organization has applied before, your organization might already have a profile in there. But there's a step-by-step guide that walks you through how to use the portal, how to get logged in, all of those types of things. So then the application itself, we have made some updates here. This is just a preview of the Word PDF version of what you would see, the question, the description of the question. I want to note, you'll see here, there are character limits. And we put these in place not to limit folks, but we also don't want you spending 50 hours on an application for us. We want to encourage you to share what is most pertinent. We don't want this to be something that is stressful and taking, you away from the great work that you're doing in the community. So there are character limits. That is something that gets confused a decent amount. It is not a word count, it is characters, and that does include spaces. So if you if you're working in Word or you copy and paste out of the portal and put it in Word and go to word count, you will see the one that is actually what our system uses is that characters with spaces. So just make sure, I know we've had some difficulty of people working in Word, pasting over, and then it gives you an error message. This is what the application looks like in the grants portal. You'll see the question. If it is a required question, there will be an asterisk next to it. And you will see anything that has a character count, you will see that indicated there. And this shows, it will do a countdown for you. Again, the spaces count, but as you type or as you put in, it'll tell you how many characters you have remaining. And then another thing we are excited about this year that we have the capability to do that we had not had the capability previously is that you can format your text directly in the online portal. You previously couldn't do that, but there's now functions like bolding, underlining, bullet points. Those are all allowable, all acceptable if it helps with the flow of sharing your work or segmenting it out. I know sometimes readability is a little bit easier when you use those functions. So those are available within the system as of this is the first time we're rolling it out. So hopefully it is helpful to you all. And then there is a section in the RFP in the application that is additional information. It is optional. You'll notice there's not an asterisk here, but if there is additional information about your organization that you want to share with us, that you want to share with the Rural Council that's doing the review, this is a place to do that. There is also an upload a file button. That you could upload a PDF. I know it can only take one document, but it doesn't mean, you couldn't combine a couple of documents into one PDF and upload that here. You can type information into the box and upload a document. So you can do either or, both, or none. You don't have to take advantage of this space, but just a space if maybe there's something that one of our questions doesn't get at that you think is really helpful to your application, use this space for it. And then if there's any modifications that are needed to make the application accessible for you, please reach out to either Caitlin or Christine, our Director of Grants Management, and they can help through this process. Again, we take the information to heart. We try and make improvements where we can. And so we are always happy to see if there's something else we can do to make this process more accessible for you. And with that, I'm going to kick it back to Caitlin to talk through the final details.
Awesome. Thank you so much, Megan. So here's our timeline. Our first proposal deadline is in April, on April 15th. Our second proposal deadline for round 2 is September 8th. So our first round of site visits are going to be in June, our second round in October. The notification of our first awards are going to be in June, and then our notification of awards should be around November. So because this is a rolling opportunity throughout the year, we've got several deadlines for those applications, as well as the dates for site visits and final payments made by the end of year. So we mentioned office hours before. So here's where I'm going to be. In Indiana, a Maxwell. In Ohio, Holy Beans. In Kentucky, Opus Pizzeria. So again, you can just kind of drop by. You don't have to give notice ahead of time. I'm going to be there between 1 and 4 p.m. each of these days. February 26th, that's coming up pretty soon. March 12th, and then again on March 26th. Some of the things that people ask me about are proposal ideas, more details about deadlines, more details about the RFP itself and the process, pretty much anything, any questions that you may have. Do not hesitate to reach out. So now let's open it up for some questions that folks might have. We're happy to answer them if you'd like to come off of mute. We're also happy to answer any questions that you may like to put in the chat as well.
Hi, my name is Kelly. I work at Welcome House. I just wanted to confirm really quick that this grant could be written for existing programs as well. Like if we're already in the rural counties working with communities there, that it can be written for that. It doesn't have to be like a organic or new program.
Exactly. If you are an established organization that has been doing great work for a long time, this would definitely be a grant that you could apply for.
Great, thank you. It's me again. Just to clarify, if you apply for round one, did, did I catch that correctly that you could be reevaluated for round two as well for an extension, or is it one or the other?
That is a really good question. An organization can only apply once a year. So if you apply for round one, unfortunately, you cannot apply for round two.
Okay, great. Thank you for clarifying.
Are there any other questions, either that folks would like to ask off of mute or any questions in chat?
Caitlin, could you say some of the past projects that we funded through this grant?
Yes, I'd be glad to give some examples. So one project that we funded last round was an outdoor classroom in Bracken County that had originally started geez, it was in the late 90s, many, many years ago. And it had kind of fallen away and fallen to disuse. And then a couple of years ago, one of the school maintenance workers had sort of rediscovered it. And it started out as a project that he was very excited about. And then some of the students got very excited about it. And the teachers sort of rallied behind it and wrote a proposal for it last year. And they were awarded a rural changemaker grant to basically renovate the outdoor classroom. So that's one example. Another example for a rural changemaker grant was there was a homeless coalition that has just started that was grassroots and sort of developed from the ground up that started out as just one person sort of concerned as a concerned individual. And they wanted to get a shelter kind of developed. They just opened their doors, I want to say, a couple of weeks ago. And they also started a multi-organization homeless coalition that spans their entire county now. And they just conducted the first person in time count that that county has had in about a decade.
So is the expectation that we serve all the counties in that region? So like I'm from Northern Kentucky, like can it be one county or is it all four of them listed?
That's also a great question. You have to serve at least one, but you don't necessarily have to serve all the counties. We
Okay,
just ask that you serve at least one.
okay, thank you. Can they, sorry, I know I've never this I'm new to this grant process, so I just have a couple questions. What can they be written for half half and half? Like can you split the funding? If if I like let's say I went for the full 70,000, could I write 30,000 and then the rest is for programmatic and then the rest could be like for an actual project or like a capital funding or like what can you split them?
So that may be something that we could talk through in more detail at some open office hours or at a one-on-one meeting. Something that goes into the finer details of how you would like to sort of split up a request based on budget would probably go into a little more detail than how we could kind of get in with this particular session. But there, because this is either project or operations funding, you have a couple of options for how you could possibly write for this grant.
Okay, great. Thank you. That makes sense.
The only thing I'll add to that is we typically don't do capital funding, like capital campaigns, like you're building a new space or something like that. If that was what the request was for, because I heard you mention capital, I would talk with Caitlin more in depth because that's typically operating support is totally acceptable, but capital campaigns aren't usually something we support with our.
Yeah, I guess what I meant more with capital is like, for example, we have a street outreach team that does go serve homeless populations in the rural counties. And I was thinking, like, what if I wrote in, like, we desperately would need like gas money put for our RV, like, but mix that with like some of our staff costs.
Mhm.
Like, if that would, you know what I mean? Like, I'm sorry, I know that that might be very specific, but that's kind of where my brain, not necessarily like a capital project, like not building a new building or anything, but just like requesting dollars for like the gas to get to the rural counties, but also be able to
Right.
cover like the salary of a staff member. Because like, I mean, 70,000 would be pretty substantial to cover both of those for our project. But okay, so I guess what I'm hearing is that that would be okay. Okay, got
And there was a question about this in the chat, but just for people who are either watching the recording or didn't see it in the chat, we will be posting this webinar on our website, along with the slides that Caitlin used. And if you are in this webinar and you registered for it, we will also be sending up a follow-up email that will also have those resources.
Okay. Do we have any other questions? Okay. So hearing none, I think that that wraps us up for today. Yeah. Okay. So I want to thank you all again for attending today's webinar. You can meet me at our office hours coming up, either the virtual office hours or any of our in-person office hours at all three states. You can also reach me. My contact information is available on our website. You can reach me via email at cbentley@interactforhealth.org. You can also reach me via phone at 606-226-0025. I'm happy to answer any additional questions that you may have. But in the meantime, take care. I hope that you all have a really great rest of your day.
Bye. Thank you all.
Thank you.